Welcome back to another episode of Terp Trends. Today, we're joined by someone who blends clinical expertise with cannabis advocacy in a way that's shaping the future of patient care in New Jersey. We got Dr. Alan O. He's a licensed pharmacist and the owner of Vigor, a forward-thinking cannabis dispensary rooted in science, compassion, and community. With a background in pharmacy and deep experience in patient education, Alan has been a vocal leader in bridging the gap between traditional medicine and cannabis-based therapies. Today we dive into his journey from pharmacy to the plant, what sets Vigor apart in New Jersey's evolving cannabis landscape, and why patient-first care remains at the heart of everything he does. This is Terp Trends. Let's dive in.
Yeah, what's going on, man? Yes, my name is Dr. Alan now. I'm a registered pharmacist, lifelong New Jersey native, and I've been working in the cannabis industry since 2018 here in Jersey. It's been a ride, man. It's really something else.
Yeah. In Jersey, is it it's medical and rec, or is it just rec, or how's that work?
Yeah, so we've been medical, or we started out medical 2010 up until we legalized by ballot 2020, and so adult use sales started the year after in 2021, and it's been legal adult use since 2021.
Yeah. And what's been your relationship with cannabis prior to jumping into it professionally?
Oh man, so I discovered cannabis really late in my life, and you know when I say the kids change your world, like it literally turns that shit upside down. So essentially, I had my first kid, right, and then I could not sleep for the life of me. Like I
Oh
was
man.
up all night just worried about like all this fucking shit that people talk about in the news about sudden infant death syndrome, and these conditions all exist, but when you have your own child, like it makes you worry a lot, right? So I developed, I guess, my own, own diagnosed anxiety. I guess I never saw a physician or a psychologist about it, but it was just something that would keep me up all night. And
Yeah.
essentially, I was looking for something for sleep, and that's how I felt cannabis. It was really amazing. Where growing up, I had a really negative view of cannabis. Even in college, I'll give you a funny story. Like I was in a fraternity. We lived in a fraternity house, and the biggest potheads were the ones that I would come home studying 4 a.m. They'd be playing Mario Kart on the couch, and I'd wake
Yep.
up for class at 8:30 a.m. and they would still be on the couch smoking and playing Mario Kart. And just I had a really negative view of, was like, man, lazy stoners and all that. And so I didn't get to try it until I was in my 30s, and I'm almost grateful I did, because
Yeah.
that allowed me to appreciate the plant for the science, for the education, and really figure out how it could integrate into my life as I needed it to, versus just as that recreational outlet that a lot of people use it for, you know?
Yeah. And were you at all anxious growing up, or did this kind of happen when you were having like fatherhood approach you?
No, man, I was a free spirit growing up, like
Yeah.
carefree, just like take the bull by its horns type of mentality. And so yeah, it was a shock for me.
Yeah. And why do you think you had such a view other than the two stoners on the couch? Because obviously you had to have something before that associated to cannabis. What do you think that was?
Oh, dude, I mean the Dare program, that
Yeah.
was high school, right? McGruff the crime dog. You remember those commercials?
Yeah.
That had,
Yeah.
the this is your brain on drugs. Like that's
Yeah.
what you're subject to, right? And like I know a lot of Asian people as well have come from conservative households. So like uh, our parents associate cannabis with opium, essentially.
Okay.
Like, you know how it used to be traded on the Silk Road back in the day. We're talking about like
Yeah.
millennia ago. But they associate one and the other. They think of it as the same thing as far as the addictive potential, the drug misuse, abuse, and all of that. So even to this day, there's a lot of people, and there's a lot of stigma that still exists in the Asian community.
Yeah. And especially going through the schooling you did, was there anything like associated to cannabis in the positive light? I feel like it was still maybe in the shadows going through your training and everything like that, from what I've gathered.
Yeah, 100%. I never learned about cannabis in pharmacy school. It was taught in one class called drugs and toxicology. Essentially, we were taught, drugs of abuse as well as treatment protocols and whatnot, but that's about it. We never learned about cannabinoids, about terpenes, about even the various dosage forms, extraction methods. All of those are like pharmaceutical processes, but we never learned any of that.
Yeah. And why do you think, now that you have knowledge of both sides, why do you think that is?
Um, my candid response is because everyone tiptoes around it, especially on the institutional level, because they're worried about their federal funding getting revoked. That's it. Like a good example, I was working in the medical dispensary in 2019 ish, and I wanted to be a preceptor. Our 6 years of pharmacy school. In the sixth year, you go site to site. Like you'll go to a big box store, independent pharmacy, a hospital system, and just shadow a preceptor, right? So I wanted to be that preceptor in a medical dispensary. And then we got all the paperwork done. And at the 11th hour, Rutgers University, my alma mater, they pulled the plug out because they're like, nope, council won't approve it because of the Schedule 1 nature. Like there's too much risk involved. So I think that's a huge
Oh,
part of it. Um, Granted, the other side of that conversation is there's no formal material that is like enough to write an actual handbook, right? Like I'm learning the things that I learn on a day-to-day basis from LinkedIn, from talking to peers. Like we're doing a lot of communication internally. There's no formal institutionalized learning. I mean, there is now. There's master's programs, the Masters of Cannabis Science. But before, back when I went to school, nothing like that existed.
yeah, it's nice seeing that more institutions are getting collaborative when it comes to cannabis and science and being able to open that door up more. Just stinks that our hands are so tied to what we're restricted to. So let's step into fatherhood. You know, you're getting anxious. These new emotions are obviously annoying. They're overwhelming. What did you lean to?
Yeah. So, well, even before that, right? Like, so that was my personal side, but professional. If we want to kind of segue into that, I worked independent pharmacy, retail pharmacies for
Okay.
pretty much my entire professional career. So,
Yeah.
I graduated college in 2009. Worked for a big box store, and I absolutely hated it. Like, it was all about KPIs and metrics and how fast you answer the fucking phone, and it was dreadful,
Yeah.
absolutely dreadful, right? It
Oh
was
yeah.
not about patient care. It was about filling numbers. It was about filling scripts and just getting people in and out of the door, right? So I left. I worked at true mom and pop shops where the mom was the pharmacist, the husband was running the front store. So I learned the ins and outs of what patient care actually looked like on a real level, right? Like where people were, everyone thinks of healthcare as just getting a bag from your pharmacist. But it's not. It shouldn't be like that. It should be a lot of the hand holding, the guidance, the counseling, and so. Part of my journey through the pharmacy industry was seeing the opioid crisis unfold.
Oh yeah.
It was appalling, right? Because we have chronic pain patients that are just taking high dose of opiates, and whenever something is wrong, like their pain medication stopped working, the first response from all prescribers is to either increase the dose or add something else. And I was like, that can't be right? Because we know opioids are addictive, and you are, letting them get to a threshold where they're going to risk impairment or any other negative sedation. Like I have no idea how people stood on their feet when they were on like Xanax 2 milligrams and Oxycontin 80 milligrams twice a day. Like I have no
Yeah.
idea how they were standing. But anyway, it made me take a more holistic approach and just really feel like we should consider getting to the root cause of things. And cannabis wasn't talked about. In 2017, they released this major study about cannabis being used for chronic pain, for appetite, and for muscle spasm. That was the most available evidence then. I was like, okay, so there's something behind this, right? And that's what led me down this path of really wanting to know more about cannabis and how to integrate it into real retail practices. So I was on the road to opening my own pharmacy as well. And then that didn't pan out because there were so many things happening behind the scenes where larger insurance companies were trying to squeeze the little guys out. And as you can kind of tell from my tone and narrative, like I'm generally pretty anti corporation to start. Uh,
Yeah.
and this is the reason why. Like they instead of letting the smaller operators operate, they would push them to the big box stores that they have backdoor deals with, right? And so these mom and pop shops, a lot of them have shut down over the last 10 years. Like you don't see nearly as many independent pharmacies as you did 20, 30 years ago. So I realized, like, okay, maybe this isn't necessarily the best model. Maybe I need a niche market of medicine to get into, and that was where cannabis came in. But once I started working in it, it opened my eyes to a completely different industry that works closer, I would say, to the CPG market versus the pharma world right now. But that's kind of the merging of the worlds of professional and personal career. So
Yeah.
discovering it for personal use and then realizing like, hey, like why didn't anyone tell us about this before? And then figuring it out on a professional level, like that's how the sausage was made.
So it's like holistic versus theory that I heard, was it like the single molecule theory that we take it with medicine? Is that what
Yeah,
it's called?
yeah, and that's the biggest struggle with cannabis and why people can't pinpoint it. Like everyone shouts, "There's not enough research. There's not enough research." There is research out there. The data out there is not as clinically significant as some of these pharma companies that spend billions of dollars on clinical trials do. But at the same time, like the biggest struggle that most people have is because cannabis has 144 different cannabinoids, a bunch of terpenes, different ways of consuming. Like if you're inhaling cannabis versus ingesting it, the pharmacokinetics are very different, right? So being able to pinpoint that and use that to a meaningful degree, we're used to single molecule because we that limits the amount of variability that we have to deal with as clinicians, right? It's like one drug that's supposed to do X, but
Hmm.
you've seen like any kind of commercial for a prescription drug, right? Like they tell you X, and then at the end of it, in 3 seconds, they'll tell you like you're gonna grow hair out of your, like legs, and just all this crazy side effects that. Um, I digress.
Yeah. 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 It is. It always blows me away when I listen to a commercial these days, and it's like 15 seconds now side effects.
Yeah.
And it's like, where are the cannabis commercials? Because they would just be funny to see. I think they've made a couple like parody commercials for cannabis, and it's quite entertaining. And and it's and it's just wild. I mean, pharmaceuticals will always have its place. I think there are things in that are so important to have in that advancement of medicine, but we can't deny cannabis as a medicine.
Oh,
Um,
100%, Adam.
I think
And I
we
want to
all
be
need it,
Yeah,
you
I want to
know?
be clear. There's a lot of people that say the plants over pills initiative. I don't truly believe that because there always is a time and place for pills, for
Yes.
traditional pharmaceutical medications. Yes, for some, like they are able to get off of all of their medications because of the plant, which is fantastic. But that's not the reality for the most people. It's just that the ones that have had such success will shout it from the rooftops, you know.
Yeah.
But keep in mind, like we have to be level headed, we have to be reasonable, and we have to take an individual approach to each of our patients when it comes to cannabis because it's such an individualized medicine. But yes, as far as the medicinal properties, they exist, but we have to make it theirs essentially.
Yeah, and I just got off a recording earlier today with someone. It's called Clear Nation Terpenes, and we were talking about ingesting terpenes and all of the medicinal aspects of terpenes, especially with the new discoveries that we're facing with all of these, with the flavonoids, and all of that. It's wild science, man.
Exactly, wild science. There's unlimited variables, unlimited combinations, and at the end of the day, if it helps my patient, who am I to disagree with them, right? Like if I think like a indica leaning strain is gonna be good for a customer, but meanwhile they're just like, yeah, I like this sativa strain. I'm like, okay, well if it works for you, that's great. Like there's no right or wrong answer, which makes it very difficult because us as clinicians are trained to have objective criteria, objective measurements to make a sound decision, yes or no, this is right or wrong. But with cannabis, we're constantly living in the gray zone, you know?
What's it like navigating that for you, going
Oh,
from that area to this one?
I struggle with this, or I
It's
struggle.
like battling your brain, I feel like.
No. I struggled with this early on in my career in cannabis because I would sit down with a patient. I would literally talk to them, counsel them for 30 minutes about, the ins and outs, cannabinoids, terpenes, different strains, and all of that. I'd give them a recommendation, and I'm like, okay, go on your way. And then I realized they walk into the dispensary and they ask
Yeah.
what do you think the first question they ask the bud tender is?
What do you like, or what do you
No,
recommend?
what is the flower that has the highest THC
Oh,
content?
I was hoping that wasn't going to be it.
That's always the I'm just like,
Yeah.
why waste my time and
Yeah.
effort? But that's the reality of the situation is you give patients autonomy to make decisions of what to purchase, how much to purchase, and how much to consume daily. And that idea of medicine kind of disappears, right? Because we are used to the pharmacy model where if you go to the pharmacy to pick up an antibiotic, it's one tablet twice a day for 10 days, clearly written on the bottle. You can't take more. You can't. I mean, you can take less, but you can't ever take more because if you go for a refill, they're just gonna be like, "Why do you need a refill on an antibiotic?" But with cannabis, like you could literally walk in and buy an ounce here in my store, and then the next day walk into another dispensary and buy another ounce there. And like we have no control. We can tell people like, "Oh, you should do this minimally to find your minimal effective dose," and all of that, all the counseling measures. But at the end of the day, they have their own personal choice, which is what is clearly headbutts with the idea of what medicine is. Like we're used to working in more controlled kind of variables.
Yeah. So how do you get more of that control? Is that possible?
Yeah, and so that's where the education part comes in, right? Like theoretically, if a cannabis consumer is properly educated, they shouldn't need to see someone over and over again, right? We teach them the basic principles about finding that minimum effective dose, where unlike other substances, so the biphasic dose response is really what I kind of preach. So if you really want to get down into the weeds, the science, right? So if you think about traditional medications like opioids, if you're on an x-axis and a y-axis, so the dose is here and the efficacy is here. So if you increase the dose, you increase the efficacious response. So it's a linear relationship where the higher the dose, the more efficacious it is. With cannabis, we don't have that. We have almost a bell curve where on the top of it is you're going to find a dose that helps with your condition maximally. But if you keep on moving the x axis over by increasing the dose, you're not going to get a more effective response. You only have a limited number of cannabinoid receptors in your endocannabinoid system, right? And so by taking more, you can trigger worse results. And we see this all the time with anxiety. Like people with anxiety should be
Yeah.
cautious. Like, hey, if you consume too much THC, you might actually get more anxious. And
Yep.
that's the bottom of the bell curve where now you've taken too much and the efficaciousness has dropped drastically because you're, huddled on a couch somewhere just trying to like make sure the sirens outside are not like real people.
Oh yeah, no, I do know. There was one time I found an old batch of cookies that I cooked. I was like visiting my family, and I found them in my old room, and I ate one or two, and I forgot how strong they were, and I had to open all the closets to make sure our house wasn't haunted. You know, I was like, I had to tell my family we had to move. Yeah, I was younger. Don't get me wrong. I grew up in this house, and yeah, it's crazy how cannabis can do that to you, especially edibles. So what do you recommend if you're ever dealing with, I'm sure you've dealt with patients before. I've dealt with it with RSO patients and dialing their regimen. If someone does eat a little too much or is a little too intoxicated from cannabis, do you believe that there are ways to bring them down?
Yeah, I know. I mean, if you're alluding to the use of cannabidiol CBD to bring them down, uh, it has worked anecdotally. I wouldn't necessarily. Obviously, harm reduction is first, right? Like, just don't take one and you wait an hour or two. Like, that's the bare minimum that we kind of have to tell people with edibles.
Yep. Yep.
But if they don't listen, like there's the peppercorn trick where you chew on some black peppercorns. Supposedly that works. I haven't tried it myself, but I've read
Yeah, I
about
never tried that one. Yeah, I did too. Yeah, the B-caryophyllene should bring it down, and the pepper.
it. That's a suspected theory, right? And then the cannabidiol in a vape pen is the quickest onset. So I suppose that if something were to happen like that, the problem in a lot of these legalized markets is the CBD products are not sold inside of dispensaries, or at least here in Jersey. Like when we have one-to-one carts or one-to-one gummies and whatnot. But if you want just pure CBD, you're going to end up going to the smoke shop down the street or the gas station.
Yeah. Are there any cultivars growing just pure CBD hemp for the market in Jersey
No,
at all?
not that I've
No.
seen. I've heard of some of the cultivators that are starting to grow it, but they're really not sure what the market demand is, because
Yeah.
what would prevent someone from just rolling or grinding up THC flower with some hemp flower they got from the smoke shop and just making their own blend. I would love to see it though, like something that's high in both CBD and THC, like 10% plus of each one.
Yeah.
But nothing exists like that on the market as I know of. But New Jersey's changing on the daily. There's new operators coming on online, so we're seeing a lot more product diversity than even a year ago here.
Yeah. Oh, that's good. And hopefully with the years expanding, you'll get more SKUs that come onto market, which will then lower prices and hopefully changes it for the public there. So what's it like comparing opening up your dispensary to the troubles of what you may have faced opening up a pharmacy? Because I never thought about that, like independent pharmacy owners versus like the big box stores you were saying, and that's like the independent dispensary growers versus these bigger MSOs that we deal with in the space. Have you felt any drag like that at all?
Adam, like when I say people complain about MSOs, they do not understand what the power of corporations have until
Yeah.
they get into like the pharmacy world is that perfect example of they went vertical, right? Like they have their pharmacies, they have the healthcare insurances, and they have the middleman who's controlling the price of the drugs. So they are what we call a vertical integration. And then, there were a lot of these companies, healthcare companies, and I'm not going to name any of them specifically, but they were buying up, urgent cares. So now they control the doctors that are doing the prescribing. So that they're controlling and dictating where you get your prescriptions from and then where you get your medications from. Like, how is that not collusion, right? But it's all within a legal framework, which so no one bats an eye. And then they did other things. Like, I'll give you an example. Like, it's like, sure, you can use the mom and pop shop and get your prescription, but it's going to cost $50 there. Versus if you go to a big box store, you'll pay $5. To the unsuspecting customer, that $45 make a huge impact. And so they don't know any otherwise. They're just saying the pharmacy is charging me $50. Like, well, no, it's the contract that the pharmacy signed with your healthcare company that is disincentivizing you from using them, right? So shit like that is the type of nonsense shenanigans that we talk about. So the cannabis industry faces that on the MSO level, but not to the same degree as these independent operators did in pharmacy world. So to answer your question, I joke with people all the time that I could have gone to a bank, pulled out $500,000 in an SBA loan, and opened a pharmacy in 3 months. But here we are, almost 4 years into this process, and we are just about to get open. And it's incredible. It's insane when I think about it. But I looked back at all my records, and I'm just like, I put a business plan together in 2021, and we are just about to open our doors now.
Yeah. Yeah,
Yeah.
but I don't unfortunately I don't feel like that's uncommon in the cannabis space
Yeah, and to
compared
be
to
honest,
anything else.
most people quit like before they get there, and it's really
Yeah.
unfortunate because I've met so many great people in this industry that just can't get funded. It's still a huge problem.
Yeah. Yeah, so what were your big roadblocks to get you started?
Um, the way the regulations kind of were written in Jersey gave a lot of jurisdiction to the local government, and some of these local governments are overwhelmed as is. So to add something like this to their plate, where they had to dictate where dispensaries could go, what the operating hours would be like, what the security protocols were, the individual fees, and New Jersey's not a huge state. We're the most densely populated state. We have 9 million people, but it's not a huge state, right? Within the state, we have 500 and something unique individual governments that now have to craft their own regulations. And that has been the biggest hurdle for us. Everything is very slow. If we think things are inefficient on the federal level, look at the state level. If we think it's inefficient on the state level, look to the township level. And that's kind of where we're sitting at, where there's a lot of bureaucracy, there's a lot of paperwork, there's a lot of, well, we don't want to be the guinea pigs that get it wrong. So I'm going to do everything in my power to go by the book, which delays us. So I'll give you an example. Like we had permitting inspections every single way, electric, plumbing, framing, right?
Oh yeah.
And there's one guy that does it. And unfortunately, if he can't make it, we had an appointment with him, but he couldn't make it. So the next available appointment was 2 weeks from now. And now we're just sitting on an empty building. We've been paying rent for almost 2 years now on this building, and we haven't opened our doors. So it's a slow grind, man.
And is that per state? That guy is like the official inspector for the state that can only be out to your property to do that?
It's not the state; it's the local level.
The local level of it. Wow. Like your city inspector or something like
Yeah,
that.
and like, listen, I don't blame them. There, he's probably overworked too. He doesn't have enough resources. But like, let me help you,
Yeah.
and let me be an active community partner, like everything we said we would be in our business plan, and let me get open so that I can provide that extra tax revenue to the township, right? Like that's the incentive, and I'm sure the local government feels that burden of like urgency, but at the same time, you have to do it in the right way.
Yeah. How many other dispensaries are in your town?
Currently, there's one other one opening down the street, and possibly a third one.
Yeah, and they're not open yet, or they
No,
are to open.
they're
No.
almost. They're probably going to open like in a few weeks, if I want to say.
Yeah. Yeah. Wow. And what was it like trying to find that location? Are you from or around the area that you picked, or how
Yeah.
what goes into that?
I would have loved to. I would have loved to open in the town that I live in. I actually talked to the mayor about it, and he was like, "I support small businesses, just not that kind." And
Ah,
we live in a little bit more conservative part of New Jersey, so I understand. But the dispensary is in Manawan, which is the town over from where I live, and so yeah, we there were no listings or no suitable listings that were in the green zone, so I had to literally knock door to door. I emailed every single business owner and be like, "Hey, are you willing to let me sign a lease here?" And yeah, there were a lot of steps in between.
yeah, there's a lot of things that go into that. Just finding the business owner that's cool with it. There's a lot of states where you sign these leases, you'll get operational, and then they'll kind of pull it from you, or they're going to raise your rent because then they try to say they didn't know what you're operating with. It gets really weird in the cannabis space just to get your shit running.
Yeah.
Like there's so many obstacles. I don't feel like, and don't get me wrong, there's a lot of obstacles in other industries, but the roadblocks that they put in place just for cannabis, it's kind of wild. And maybe it's because they just opened the gates without the infrastructure down for us to run. But it happens in every program. Like it's every state. It's not just Jersey,
And I
like,
think the most frustrating thing for me is that like I'm a pharmacist by trade, right? And like
yeah,
I wear a lot of different hats on any given day. But one, I do not enjoy politics, but I had to learn politics in order to participate, right? Like I had to learn how to read ordinances, how to look at a zoning map and figure out where this green zone was, and just like all these different things that I'm not classically trained in. But at the end of the day, it's all for a purpose. I want to get open so that I can do what I do best, which is try to merge that world of healthcare and cannabis. Like that is really what my story should be. And the fact that we're even talking about getting open, it's frustrating to say the least. I'm just excited to get open, and I want to really show the world what we're doing and what we're about.
yeah. When's that date? Do you have a date yet?
No, I would say a few more months. I'm gonna every single date or milestone that I've given to people has been wrong the last 3 years. So,
Yeah.
we'll just say sometime this year.
Yeah, I get it. What's it been like designing the space? Are you hands-on with it, or are you kind of trusting someone else
Oh boy,
to
that's
take
another
the
story.
process?
Yeah,
Yeah,
and again, we have this beautiful design concept. We had all the millwork planned and everything, and then because of how long everything has taken, we just had to scale back. We had to downsize a lot of the bells and whistles that we originally wanted to open with. Like, I don't care if we open with an empty box and like a shelf from IKEA. At the end
yeah,
of the day, like that. there's no point in spending money in these lavish, elegant stores if your customer service sucks, right? Like I've walked into
Yeah.
beautiful dispensaries, like epoxy floors, diamond cases, like jewelry cases, and their bud tenders don't know shit. And I'm just like, okay, well, that's kind of a waste, right? Like aesthetically great, but I would rather focus my time and energy on educating my bud tenders to the best available, customer service, number one. The medical aspects is number two. Obviously, if a bud tender is never going to give someone medical advice, but we teach them to solicit questions, really figure out what the customer is comfortable with, the different dosage forms, pharmacokinetics, all of these things that a normal dispensary worker doesn't learn. But because so I've been in education for the last couple years. I taught NJ Cannabis Certified, which is it was associated with Raritan Valley Community College. I was with the Mud Brothers at Minority Cannabis Academy. I did their bud tending course, and then this semester and last year, I'm teaching a course for Rowan University as well. So it's just essentially bud tending 101. But this is exactly the kind of programs that bud tenders need to have, because it's not just about working a cash register. It's about being able to talk to someone, because anyone can do the cash management, anyone can do the inventory control. But to be able to speak to someone that can, you don't, when a customer comes up to you, you don't know if they're using it for recreation or for medicine, but you ask one question and you can figure that out.
Yeah. No, it all comes down to the bud tender training. I mean, that's what I always love to do, is just kind of sit in a group of bud tenders down and go through the proper ways to just educate, but also take the order at the same time, and then also how to kind of lean into the education where pain management doesn't have to be associated to higher percentages. We can wiggle something else in there. We just have to learn how to do that with our wording and listening. So that's cool that you've taken that initiative of education on your back, man. What's it like, the public aspect to that, and training these up and coming bud tenders or just cannabis enthusiasts? What's that like in the community?
Yeah, so we're actually going through the hiring process right now, and a lot of the resumes that I've drawn were actually like, if they have previous cannabis experience, it's great. Like that's almost like an automatic in. But I've been heavily looking for bartenders and
Yeah.
waiters, people in the food service industry. They're used to high volume. They're used to dealing with pissed off customers. They're used to being on their feet all the time. So there's a lot
Yep.
of translatable skills, and you wouldn't believe the plethora of resumes that I get, like retired law enforcement, psychotherapists, like people with master's degrees that are like close to retirement, and be like, "Hey, can I get a part-time job?" And I'm like, "Sure, why not?" Right? Like there's no expectation that you're going to walk into a dispensary and have like a stupid or uneducated 21-year-old bud tender. That's a stereotype where nowadays
Yes.
I love walking into a dispensary and seeing a worker in their 50s or 60s that can just have a candid conversation with you about their products, their usage, and all of that.
Well, that generation is just so hyped to have cannabis and not be scared.
Yeah.
Like, it's just so cool to see how excited they are and then not have to be scared. And then to have that in your store too, it adds a whole different type of camaraderie.
Yeah.
Was
And our target demographics, like we're gonna do things a little differently, right? Like we're gonna have our daily, weekly consumers, the ones that are just shopping based on price. We have to take care of that part of it, right? Those are the people that are gonna be a reliable source of revenue. But at the same time, there's nothing preventing people from going out into the community, into neighborhoods that are untapped. Like one of the things that we're gonna do is go to 55 and up communities, right? Just they all have community centers, so you ask to book a room with them, and you have whoever come wants to come comes, right? They're not medical patients; they're just people that live in the community. They're probably active adults playing, pickleball. They'll kick my ass in pickleball or tennis at any given day, and they just want to learn about cannabis. So things like that are thinking outside of the box. What I really want to do is get into collaborative practices with local physicians, urgent cares, and just be like, hey, if someone is interested in cannabis, just send them our way. We'll take care of them inside, but also we want to work with you to either understand what the patient needs, because they don't tell us the whole story when it's not like they're coming to the dispensary with their medical records, right? They
Yeah.
come with us like, I'm looking to treat my sleep, have insomnia and need to treat my anxiety. Like, okay, so let's see how we can help. But really working hand to hand with the practitioners, that is my ultimate goal of how I can see Vigor Dispensary aligning to bridge that actual gap. Everyone says bridge the gap, bridge the gap. So it's like, okay, well, how do you do it? It's like it involves talking to the actual physicians that are taking care of the patients, and we're just an extension of that instead of a retail outlet where they're just buying products.
This episode is brought to you by Waddle, the world's fastest and easiest way to review and track your medicinal cannabis products. Waddle offers batch-specific reviews, so you'll know what to stash or what to trash. It's exclusively available for Pennsylvania medical cannabis patients. Waddle helps you take the guesswork out of your cannabis journey and ensures transparency with the verified product tracking. Download Waddle now on iOS or Android, that's WODL, and take control of your cannabis experience today. Are you going to have like medical professionals on site? Do you have to have that in Jersey like we do in PA?
No, no. Even our medical program didn't require pharmacists. So we were in a unique. My partner back then and I were in a very unique situation where we were pretty much the only pharmacists in Jersey working in a medical dispensary, which is mind-boggling, right?
Yeah.
Um, but the short answer is like I will be there on site to help our customers. Either like meet your pharmacist Mondays or something of that sort. Eventually, I want to have a nurse that's there all the time, or even so. This is my unpopular truth, and I've had debates about this with people. Like, I don't think a pharmacist is absolutely necessary inside of medical dispensary. And hear me out. Like, I would much rather have a well-educated nurse or a licensed social worker there than an unenthusiastic pharmacist that's just there by mandate, right? Like, that doesn't help anyone if they're just there because they're required to be. Like, I want someone, a healthcare a clinician, to understand the product, be a consumer themselves, and be able to talk about it again very candidly. Because we're not talking about white coat medical service. We're talking about what product is going to make this person better once they leave our store. Like that's it. My idea of healthcare is very simple. Take care of the patient, take care of what they need, make sure they have the best experience, whether it be for health or for recreation. And I consider that a win.
Yeah. What goes into your whole like if you're going through someone's diagnostic of how they should use cannabis in their regimen, what are things you consider and then how do you kind of get them on their way?
Yeah, sure. And it's mostly about their comfortability because if someone, for example, if someone says like, "Oh, I don't want to smoke," I'm like, "Okay, that's fine. Are you open to the concept of vaporization?" And they're just like, "What's that?" And then you have a whole product arsenal that you can teach them about, concentrates, vape carts, either that or use a dry herb vaporizer, right? Like because that is something that not a lot of people talk about, but is extremely efficient because not only are you getting the therapeutic benefits of an inhaled cannabinoids, but you're getting the leftover material, plant material that you can make into your own edibles. You can reuse it, you can eat it, whatever you want to do with it. So that's a teaching opportunity, right? We find where their hesitancies are and we challenge them on why they feel that way in order to make them feel comfortable. But realistically, most people, if they want ingestible products, that's great. Then the decision comes down to, okay, are you a diabetic? Because if so, you avoid the chocolates, you avoid the gummies, unless they have a sugar-free, which most of them taste like garbage. But um, then you got to move to the tablets or the lozenges or something else of that sort. So those kinds of decisions are the ones being made at the counter, right? Like, but we have a script that we're going to use that's maybe 3 or 4 questions long that you can easily again determine with efficiency because the last thing you need is someone standing at the register for 15 minutes with a line growing behind them.
Yes.
One of the points that we have in our dispensary that I haven't seen a lot of dispensaries have is we have a separate counseling room. So if like people want to break their walls down and just really talk about their problems, then we have a private space on the side that's
That's
away
cool.
from people, completely isolated that they can just, bare their soul. We'll have a box of tissues there. We'll have some, pamphlets. We'll have magazines, pictures, and the whole 9 yards. But that individual service it can't come from a bud tender because they can't spend 30 minutes with one customer. It's just not an operational, it's not operationally efficient.
Yeah, and it'll happen sometimes.
Yeah.
It does, it does happen. Sometimes you just have the one staff member that has the patience for it, and you kind of just push them off and go off and do what you do. But that's really cool taking that approach with the counseling room and giving people another safe space in the safe space,
Yeah, and
you
it's
know?
it's about the hand holding, right? That's a playbook right out of the independent pharmacy world, where instead of answering the phone or worrying about, if someone corporate calling me because I didn't answer the phone within 7 seconds, like I'm gonna stand there and talk to my customer until I feel comfortable that they understand what I'm saying. Let the phone go to voicemail. I'll call whoever is on the line back later. Like that's not a big deal, but you can't do that in a normal, corporate environment.
Yeah, and you have to have that space to be able to get us with the plant where we're trying to go.
Yeah.
Everyone should have that time. So in the dispensary yourself, do you have any products that you're looking forward to carrying that you would always recommend for consumers?
Yeah. So as a pharmacist, we're kind of partial to ingestible products, and the reason why is dosed by weight instead of dosed by volume. So milligrams are repeatable versus if you're giving someone even a vape card or a joint or a pre-roll flower. Those THC percentage are in percentages, which is really hard to gauge how much they're using.
Hmm.
And so when we talk about finding a minimum effective or minimum therapeutic dose, uh, talking in milligrams is always a lot easier of a concentration. Even with RSO oils, right? Like 1 ml is one increment, and RSO can be extremely potent, right? Like that point one, not we're not even talking about 1 milligram, but we're talking about point 1 ml
Yeah.
of
Yeah.
product can have a huge range of difference. So being able to guide them and being able to titrate them, like dosage, adjust them in those types of increments, become extremely important versus like, oh, you take either one puff or two puffs. Like, okay, well, what is a puff? Do I draw for 4 seconds? Do I hold
Yep.
it in my lungs? Am I
I
just
remember those days. Yeah.
yeah, that science is not exact at all, and like you can theoretically calculate it, but that formula only works if it's in a contained vacuum, like where you're constantly puffing it. If you even take your lips off of the joint for like a split second, then that milligram just goes out the window.
Yeah. So how do we center on this and regiment more people?
Um, One of the things that I tell people is you got to take a scientific approach, right? Like if you're going to empower the consumer to use cannabis as medicine and treat cannabis as medicine, then they have to take it into their own hands of really tracking. You can use a log, you can download. I love Tetragram app. With Otha, if you need another podcast guest, he's absolutely brilliant. So I would highly recommend him, Otha Smith.
Yeah. Yeah.
Um, so write everything down. What product, how much did you use, how did it make you feel? And having your own set of data points that I can look through will help me guide you better the next time and the next time and the next time until we don't need that anymore, right? The goal is to really just figure out what products work as far as the onset and duration. So making a decision between ingestible products versus inhaled products, that onset duration looks very different as we just talked about. So being able to be like, okay, well, if you are a stay-at-home mom, that is not working, but then you have to pick your kids up at 3:30 p.m. from the school, like just make sure you're dosing well enough so that you have enough wiggle room where you're not just like, oh shit, I gotta, like, where are my fucking keys? I gotta go pick up the kids. Like that's the last thing you want. Like you have to be intentional about your consumption, about what you're consuming, how much, and then how often, right? Like that is the three questions that I ask people to always think about. What product are you consuming? How much of it are you consuming and how often? Because those three things alone, like if you are intentional about that, you can use cannabis to your advantage, right? Versus as a okay, Friday night, just gonna, like have a cookie or two or three and just be cool with it. But if we need to be functional, we need to be parents, we need to be people that work 9 to 5 jobs, then we have to be able to use this to our advantage. And that's exactly how you do it.
Yeah, and it's very fascinating that cannabis can really cater to whoever's using it. It really caters to the consumer. And you can use a product or find a product that has cannabis in it to suit your lifestyle, which is sweet. Like you said, the highly functional person, to the teacher, to the lawyer, to the dad who's getting anxious about fatherhood. You know what I mean? Like there's so many ways that you can consume cannabis. What has been ways that you personally have found helping you? Not being introduced to it at a younger age and now using it medicinally as a an adult.
Yeah, so it's kind of funny, right? So that was my first kid, and then after I had my second kid, like I'm just exhausted all the time. So if you want the best sleep remedy, just have a second kid, and then you won't have any problem falling asleep.
Yeah, yeah, hell yeah. For the first kid, did you dabble like with CBN or like CBD or anything like that?
We didn't have any of that here in Jersey.
Yeah,
When I went to California, I would pick up some stuff, just here and there. But our medical market was pretty bare bones back then. There was no product variety, and believe it or not, like Pennsylvania actually has a really great medical program. Like I've seen your menus, I've seen your prices, and I'm just like, shit, why can't Jersey have this, right?
yeah,
But as far as product selection goes, it was limited back then. But nowadays, it's I would say I am an infrequent consumer where if things get so here's me, right? When I need to be creative, I can use cannabis frequently. But if I need to be technical, if I need to read something or write, I can't. Like that's just me. I
yeah.
cannot do that because I'll just stare at a screen. I'll backspace that same sentence, write it again, look at it for another 6 seconds, and then backspace the entire thing. That's just how I operate, right? So right now in my life currently, I'm in a technical mode where we need to get our store open. So like I'll enjoy, partaking here and there, but it's not nearly as much because not in the creative state right now. Give me a couple months when the store's open. How do we make this better? How do we make our patients better? How do we get the customer count go up? All of that is going to happen and fall into place.
Yeah, dude, especially. And I think it's sweet that then you're going to be able to celebrate more with like a celebratory J or something like that.
Hell
And
yeah.
then it ties into the ritual and then it's a better association to it. You know, you can take it when you need it and it doesn't always have to be there, but it's there when you do want it, you know?
Yeah, that's healthcare, right? Like doing what's best for you. I think the overall narrative that I'm just trying to get from and the message I'm trying to get out to the world with our dispensary is that like healthcare does not have to be boring, right? Like empowering yourself to take better care of yourself, like it seems like a pretty easy ask, right? Like just like don't eat too much sugar, like go for a walk, enjoy nature, or enjoy relaxing and doing the things that you actually like doing versus what the world expects you to do. Like all of that is related to mental health, which is a form of healthcare that people don't talk about at all. Like just understanding the nuances of figuring out your own body. And we're not talking about medical debilitating conditions because those people are the ones that really need the help. We are focusing on that part and also the people that want to live their best life, right? So that's the other side of healthcare where how can we use cannabis as a tool to make people's lives better, to function better, to be more creative, to be more loving, more nurturing. And a lot of these principles that people seem to have forgotten after the pandemic because like the stereotype everyone in Jersey like drives like an asshole. It's true. Like there's not enough love
It's
in this
true.
world anymore.
Yeah. Well, yeah, but I don't know if even if there was love, if Jersey's drivers would get better. You know, I don't know if it's a love thing when it comes to the driving, but I do understand what you're saying, 100%. What do you think as a community? You know, you're out here, you're educating, you're going to be educating. What can we do as a community? Me, podcast hosts, listeners, what can they do? How do we bridge this gap with you? You know, you keep talking about bridge the gap. So what can we do to help that?
I would say call out the shenanigans. Number one, there's so much, uh, to be frank, like bullshittery in this industry, and to really like don't associate yourself with bad people. Like that. That's it. Everybody that I've met in this industry has been really genuine and kind, but then there's a couple bad apples in there that I'm just like, dude, like they get into this industry for the green rush, the money. And I'm like, okay, great. And then they fizzle out when they realize it's not easy because it's not. Like we're trying to build the entire industry and we have the ability to craft it the way that we want it seen. But there's a lot of outside influence. So call it out when you can. It's really unfortunate that we have to even say that, but most people are just like kind of just kick the dirt, put their tail between the legs, and just like kind of go about their day, you know. Um,
Yeah.
but that
The bystander effect.
Yeah, yeah.
Yeah. Yeah.
So yeah, I would say my ask is just be real. Like move the industry forward, elevate it. Like we want the entire industry to break free from all the stigma. We're always going to counter the negative Nancy that's going to be like, devil's lettuce and all that. But for the most part, like just share the message that cannabis was medicine 10,000 years ago, and cannabis still is medicine. That is one of the things that people don't understand, where was used for millennia as medicine versus only a century ago that it became prohibited because of political beliefs.
Yeah. Yeah. Let's not get into the political
Yeah.
beliefs this episode. We'll
Right.
keep it positive. We're doing good right now.
Yeah.
So, do you have social medias up and running for the store yet?
Yeah. So our Instagram is live with vigor. Our slogan is live with intention, live with vigor. Right. And so we are. Um, Yeah, so we are on social media. We don't have a huge following right now because we're obviously not open, but we're slowly getting there. We're doing a lot of cool community events, like on 420. Since we're not open, we can't offer any sales or anything. So instead, we're doing a community cleanup where we're going to a local trail and we're going to pick up trash, right? Because
Nice, dude.
420, Earth Day, things like that. Whatever we can do to stay engaged with our community. And that's another thing that I encourage all dispensary owners to do. At the end of the day, there was a race to get open, right? Being first to market, that was phase one. Now we're in phase two, where it's like, okay, now only the strong survive. Where make those bonds with your local community, with the local restaurants, the local bars. Like this is my hat from Alternate Ending, located in right across the street from us on Route 34. And they've been phenomenal. Like it's small craft beer. They took over an old theater, so they still have some of the original seating there, and the staff is beautiful. We have a great partnership. We're going to do some collaborations when we're open, and just like things like that. Talk to your local neighbors, your local physicians. Talk to the actual community, and be that community partner that we kind of missed out on, right? Like I think that's the people get open and they're like, okay, come by, and I'm like, well, you don't give enough out like back to the world, so why would I come support you when now I have 10 dispensaries to choose from, right?
Yep. Yeah. No, I think what I try to tell companies is your legacy story. People are gonna come to buy it for you, um, next to your competitor, because we're all selling the same product. Unless you're growing it yourself, like you just said, why would I come to you? And I think you're doing that legwork to prove why people should be coming to you, man. And that's sick. And I applaud you and thank you.
Appreciate
Industry
that, man.
wide, I think people will thank you. I hope they do when they listen to it, because we need more people like that. We need people from your side of medicine to understand that this plant is so beneficial, and unfortunately, like people that aren't from other avenues, like we can't do it alone. We need everyone else from other avenues to understand that it can merge successfully, and they can exist together. It's not something to be scared of.
Yeah,
So
100%. How can, and other way around, right? How do I help you in your travels? Like, what how do I help you be successful and keep doing what you're doing,
Oh, dude, nothing. You're already doing it. You're creating a story. That's all I ask. This plant is for the community. That's all it is. And as long as you stay true to that, that's all I can ask for. That's all I want, from anybody in this space. Be true to the plant. Be true to yourself, and let that speak for you. Put it
Yeah,
that way.
good words to live by, man.
Yeah, dude. All right, sweet, my man. Thank you for your time. Do you have anything you want to plug in at the end of this?
No, come visit us, Vigor Dispensary. We're located at 1082 Route 34 in Mattawa, New Jersey. I'm gonna say like June or July is our current timeline. I'm gonna give that date out, but just follow us on social media. Give us a like, give us a follow, engage with us, and we'll do the same back to you.
Yeah, yeah, and we'll be back, and I'll be at that grand opening, dude. I'm excited.
Sounds good.
Hell yeah, my man. All right.